Dr. Hussein Bolachi and YouTube channel is giving you latest information on Naeglaria Fowleri, a very common amoebic or parasitic problem. It is a microscopic small problem organism which has been identified since long, but in Pakistan since 2008 is reported, and so far Karachi city is showing the largest number of the Naeglaria Fowleri, and we call it brain-eating amoeba. So coming to that point, this is Pakistan, and coming to the latest situation that Pakistan is a hot spot for infection, and the Naeglaria fowleri is a microscopic amoeba, which is a single cell living organism. It can cause a rare and devastating disease of the brain called primary amoebic meningoencephlitis or PAM. The amoeba is commonly found in warm fresh water such as lakes, rivers, ponds, and canals. And all these are present in Pakistan. So infection can happen when contaminated water enters into the nose orifice or nose cavity. Once the amoeba enters into the nose, it travels to the brain where it can cause pan-amoebic meningoencephalitis, which destroys brain tissue and is usually fatal. Infecting usually Infection usually occurs when it is hot for prolonged period, as is the situation in May, June in Pakistan, which results in high water temperature and lower water level. So that is a favorable condition for that. Regularly, fowleri infections are mostly uh, exposure to contaminated recreational waters. But in Islamic, as Pakistan is a Muslim country, so we have a religious obligation of ablution, or call we wudu or wuzu. So that is before the prayer, and one of the uh, watering or cleaning of the nose, starting from the hands, mouth, face. So the nose is 3 times cleared. So if this is contaminated water, it can give another problem, and it can reach malaria powdery problem can occur. Practice of ablution is included in Ayurvedic, yogic, as well as in the Islamic tradition, but particularly Pakistan is a Muslim country, so Islamic faith rituals, nasal rinsing is included in the cleansing process called wudu or ablution. It is usually performed several times a day, mostly 5 times, but if you are a regular prayer offering person, then anytime you can start the prayer. According to the disease control, you can see this picture. Even in poor people, they usually take water, and sometimes the Naegleria can go into the nasal cavity. And this is another way that even you can see that the poor boy and the drinking of water is very close to the nose, and Naegleria can reach to that area. This figure shows that the Naegleria is related to the high temperature, as well as you can see that in the month of it starts in warm months, and it reduces in the colder months. Uh, and from USA data, since last half century, 142 cases have been reported, but in Pakistan in last 12 to 14 years, 146 cases, and now if we add two more cases, then we have 148 cases. So coming to the swimming and recreational, so most of the affected people are uh, not from the recreational side, but this is the domestic water contamination in Karachi, which is causing more problems. And you can see that how nasal cavity is important. And Naeglaria fowleri is responsible for the disease. The infection is fatal in 98% of cases. And in Pakistan, Karachi, which is a major metropolitan city, coastal site of Pakistan, the first case of PAM was Eating Amoeba was reported in 2008, and up till October 2018, 146. I already mentioned that in the USA, and here in this slide, the same is reported. You can see once again that how the problem is fast in Pakistan, and we must pay attention on this. So the highest number of PAM cases in USA were reported in last. So the age difference is the children are affected in the USA, while we have young people under 40, 45, they are affected. Of all the reported cases, PAM in Pakistan, all were in Muslims, and only two individuals had a history of recreational water activity. So you can understand that how the five-time prayer and the mosque and their water quality is important. Mm, coming to the uh, some of the pictures, you can see that how the water is important, and the Naegleria patients can be in a very serious situation. And the prevention actually is chlorination of the water and avoiding the uh, nasal cavity with cleaning up with the hot water. And if you have safe water, chlorinated water, and even the boiling can also kill the amoeba. So these are the few options, and hand washing and use of safe water is important, particularly in the hot summer. And it also shows that it has 20 strains of Naegleria fowleri, and only the human pathogenic is only Naegleria fowleri. Uh, owing to the fact that Naegleria fowleri has unknown and possibly multifactorial mechanism of the pathogenesis, uh, so a deep insight is needed. A genomic approach can be applied to the diagnosis, and all our laboratories, particularly in Hyderabad, Karachi, and divisional headquarters, must have a facility to diagnose and detect the Naegleria fowleri so that we can have. So wherever the ponds and the tanks are there in the small or large cities or in the villages, chlorination is the question, the way out, as well as boiling can be practiced. And if water is in the warm temperature, then at least we must have a chlorinated and safe water. Dr. Hussain Polaki will provide you the latest information. I think you will have some insight and some of the data available in Pakistan, and from Pakistan and Hyderabad city. I always feel that this is a very airy city, but Karachi, as the ocean is there, there are hot springs also. We call Banora springs, and at the same side, we have another hot springs. So people who are going for there for any purpose, they should take care because of going these hot springs at Simon as well as at Manora or any other place in the world. Thank you very much for watching my YouTube channel. Please leave the comments as well as subscribe and anything new, we will have a new video also. Thank you very much. And recording and